Hello everyone, good morning. My name is Jorge Espinoza. Welcome to this listening and speaking for assignment, video number 2. It's a great pleasure to be with you today. And the topic for today is the two more common types of sleep disorders. So in order for us to understand a little bit better about this topic, let's first see what are sleep disorders. Sleep disorders are conditions that prevent a person from getting restful sleep. As a result, the person may experience daytime sleepiness or dysfunction. There's quite a few types of sleep disorders. However, today we're going to talk about the two most important ones, which are insomnia and sleep apnea. Let's talk about insomnia. Insomnia is a sleep disorder that it occurs when the person has difficulty falling asleep or staying asleep. There are 5 symptoms that you should be aware of in case that you suffer from insomnia, and these ones are difficulty falling asleep, waking up in the middle of the night and having trouble going back to sleep, waking up too early in the morning, failing in getting a refreshful sleep, and experiencing at least one type or of daytime problems such as fatigue, such as lack of concentration, such as mood swings, or accidents at work, or even accidents while driving. Insomnia, it can occur due to several causes, however, is mostly related to psychological or medical problems. It also varies on how long it occurs and how long it lasts. According to a recent research conducted by experts, it is reported that 50% of the population have experienced some type of short-term insomnia and 10% a type of chronic insomnia. In order for insomnia to be called chronic, the person has to suffer from this dysfunction at least 3 times a week and for a period from 2 to 3 months. Now, let's talk about sleep apnea. Sleep apnea is a very serious sleep condition in which the person's breathing is interrupted while asleep. People who suffer from sleep apnea have reported that they wake up gasping for air in the middle of the night. As a result, their sleep is interrupted. There are 2 types of sleep apnea. One is called obstructive sleep apnea, and the other one is called central sleep apnea. Let's talk about the two a little bit deeper. The obstructive sleep apnea, it occurs when the person's airway passage is blocked due to a collapse of the back of the throat tissue that prevents the airway passage to breathe, and people wake up in the middle of the night gasping for air. The other type of sleep apnea is called central sleep apnea, in which there's no blockage of the airway passage. However, this one should be considered a little bit more serious because the brain fails to tell the body to sleep. People who've experienced central sleep apnea reported that they wake up gasping for air, but they also wake up several times during the night, whereas people who suffer from obstructive sleep apnea experience symptoms such as fatigue, such as lack of concentration, daytime sleepiness, restlessness while trying to fall asleep, etc. It is very important for you to be aware of these 2 types of sleep disorders because they need to be treated immediately because it can have several consequences when it comes to your health. So it's my personal recommendation that if you suffer from any of these 2 types of disorders, you should check with your doctor immediately so that you can deal with this problem as soon as possible and have a happy and balanced life. Okay, so it is all for today. I look forward to see you in the next video. Bye for now.